Hello, everyone. Hello, everyone. My name is Fatima Hidayat, and I'm a fifth-year medical student from the University of Central Lancashire. And today we're going to discuss the breast station. So this topic can come up in three forms in your OSCEs. There's a delay with changing the slides, yeah. So it can come up as a history-taking station or an examination station. And if you are in your penultimate or final year, it can come up as a focused history plus examination. So we'll start with history taking. So you can start by introducing yourself, asking the patient's name and date of birth, and explaining what you're going to do now, and consent. So you can say something like, I will ask you some questions about why you're here today and some other questions about your general health. Would that be all right with you? And then you can give them a minute to tell you what their presenting complaint is. And usually in that minute, which is known as the golden minute, I'm sure you've heard about it before, they'll give you some valuable information. Once you've started with an open question and given them their golden minute, you can start with your closed-ended questions in order to explore the symptom. So an easy way to start is by asking about the time frame. When did it start? Or when did they first notice it? And then depending on the symptom, you can ask about the progression. So let's say it's a lump. You can ask, has it stayed the same size? Has it gotten bigger? Or did it get smaller in size? Or for example, if it was breast pain, is it a constant pain or does it come and go? Next, try to identify triggers. So again, within the progression part with pain, you can try to see if it's related to their periods, something that's known as cyclical pain, or try to identify other triggers. If it was a sudden lump or sudden pain, you can ask if something happened before they experience it. For example, trauma to their breast. So here I'm trying to exclude fat necrosis, especially if they had a high BMI. Then with symptom-specific questions, you can ask if the lump moves or if it doesn't move. So a lump that moves will point you more towards a benign cause rather than a malignant cause, while a lump that is fixated will point you more towards a malignant cause. Is it painful? Is there any nipple discharge? And if there was any nipple discharge, you try to see or ask about the characteristics of that discharge. Is there any blood in the discharge? Is it green in color? Is it white in color, etc.? Then, whatever the symptom was, ask if there are any nipple changes. The most important one is nipple inversion because it's a very important indicator of breast cancer. Or if they had any itching in the skin on the nipple or around the area of the nipple, if there's any erythema or ulcerations. With any symptom, try to find out in the beginning of your consultation if it's just one breast that has the problem or both breasts. Next, you move on to your general systems review. So you try to signpost and say, so now I'm going to ask you a few general questions. It might not be directly related to you, but it's important for us to know. And then again, because you're moving to another component of your history taking, start with an open question. So how have you been feeling in yourself lately? So once you've asked your open question, start again with your close-ended questions. Have you been experiencing any unintentional weight loss? Have you been experiencing any fevers or night sweats? Have you been tired? And of course, avoid medical jargon like lymphadenopathy. So you can ask something like, have you noticed any lumps or swellings anywhere else in your body? Now, I'm just going to ask you a question. Why am I specifically asking about bone pain here? Just have a few seconds. You can either unmute yourself and answer or drop your answer in the chat box. Exactly. I'm seeing the answers right now. Yes, because breast cancer usually metastasizes to the bone. So I'm trying to rule that out. Again, on the same note, breast cancer can also metastasize to the lung. So you can ask something like, have you been experiencing any difficulty breathing? Now, if the main presenting complaint was nipple discharge, you can ask about any visual problems. Why? Because I'm trying to rule out a microadenoma. If a microadenoma was large enough, it can actually press against the optic chiasm and cause visual problems. This isn't always the case, but you can just show the examiner about your, clinical reasoning by asking that. So once you've asked your general systems review, you can move on to ideas, concerns, and expectations. This component of your history taking actually has a lot of marks. Some people prefer to ask it before exploring the symptom. Some people prefer to ask it right at the end of the consultation. What I usually do is try to save this, and because in an exam setting you can just go blank or run out of questions, so you can always save this and ask it whenever you run out of questions. And these are some sample questions on what to say. Any questions so far, guys? Okay. So next, you move on to past medical history and drug history. Here, you're trying to rule out certain risk factors that could be important. So you can again signpost and say, do you have any medical conditions? And then if they listed their medical conditions for you, you can say, do you receive any treatment for that? Now, even if the patient told you that they do not have any medical conditions or they do not use any regular medication, still specifically ask about over-the-counter medication. Patients sometimes forget to mention that because they think these are not important as they're not prescribed. But here specifically, because of the risk of breast cancer, I'm trying to find out if my patient is using any combined oral contraceptive pills or if they're using any combined hormone replacement therapy, depending on their age. You have the option of asking about herbal medication, and don't forget to ask if they're allergic to anything or what that reaction is if they're allergic to something. Next, you move on to family history. Again, here specifically, I'm looking to see if my patient has a first-degree relative, like their mother or sister, who's had breast cancer. If yes, try to find out if the person who had breast cancer was postmenopausal or premenopausal. That's also important. Even if they said they don't have any medical conditions that run in their family, you can still specifically ask about breast, bowel, or ovarian cancer. You can also ask if they've had any surgical operations on their breast as part of your past medical history. So that could be implants or an excision or anything. Smoking, again, is an important risk factor in breast cancer, and it's always good to cover alcohol consumption as part of your social history. So now that you've asked all the relevant questions, you can summarize and at the end ask something like, have I missed anything, or is there anything else that you would like to tell me about your symptoms? And just see what the patient tells you. And if you felt comfortable enough, you can end your consultation, communicate with the patient and let them know what the next steps are. For example, so now I'm going to report to my senior, and then you can present your findings and differential diagnosis to your examiner using the SBAR. So this will bring you to the end of your consultation. Before we move on to the breast examination, do you have any questions for me, guys? Again, feel free to unmute yourself or drop your question into the chat box. All right, so even if we move to the second section, you can still ask questions about this section. So Breast examination. You introduce yourself. Hand hygiene is very important. You ask for the patient's name and date of birth, how they would like to be called, and then you explain what you're going to do today and get consent. Chaperone is very important in this examination because it's a sensitive examination, and make sure that during your explanation of the examination, you let your patient know that they have to be fully undressed from the waist up, and try to see what you have there in the station. So if you saw a blanket there, then offer them so that they can cover themselves with the blanket. Next, you ask the patient to sit at the edge of the bed with their legs swinging down, and you do your general inspection. So I have a tutor that always says it's okay to be dramatic during stations, as in you have to show what you're doing to the examiner. So actually take a step back, put your hands behind your back and say that, okay, I'm looking at my patient. Let's say my patient's name is Sarah. I'm looking at Sarah. She's sitting comfortably at the edge of the bed. She looks well, and there is no evidence of cachexia. That will give you the full marks for, that should give you the full marks for general inspection. Next, you do a more focused inspection of the breasts. So this is when still your patient is sitting at the edge of the bed. Again, try to be dramatic. You have to look from the front and move to the sides with your whole body and show the examiner that you're inspecting everything. So you check for asymmetry of the breasts. I don't have a picture here for asymmetry, but then you look for any local swelling or lumps, which is the first picture at the top. You look at the nipple for any obvious nipple discharge. And again, you describe the characteristics. Yes, is the cursor, yeah. And then you look for any dimpling. You can look for any nipple retraction or inversion, and you can comment if there is any eczema or Paget's disease of the nipple. You can also comment on any redness, any changes to the skin texture, which is, for example, pédorange, or any generalized swellings. Once you've done that, and once you've looked from all the sides, if your patient had larger breasts, you can ask them if they can lift it for you so you can see the submammary fold. Any questions about this part, guys? Okay, so the inspection that I described in the previous slide should be done in 3 different positions. The first position, the patient is sitting straight with their arms relaxed next to them. The second stage, you ask the patient to put their arms on their hips and pressed against them so that their muscles would be tense and you would see any lumps that weren't obvious while their arms were relaxed. Next, you ask them to put their hands like this around behind their heads and push their elbows backwards. So again, you're tensing different muscles and trying to see if any obvious lumps come up. And when at the same time, when the patient's hands are behind their back, you can also show the examiner that you're looking at the axillae for any skin changes or any obvious lumps again. So next, you ask the patient to sit comfortably, put their legs up on the bed, and relax their back to the bed at 30 degrees. So you always start with the normal side or with the side that does not have any problems. So let's say, again, you want to start with the right side. You ask them to put their hand behind their back and relax. And then this would basically show the tail of Spence or make it more accessible to you for examination. With your non-dominant hand, you try to stabilize the breast, and with your dominant hand, you use the palmar surface of your 3 fingers like this. And in a spiral motion, you try to palpate and check for any lumps or any nodularity that might come up. And then you use, again, once you've examined the breast, you use your thumb and 2 fingers to examine or palpate the tail of Spence or axillary tail to see if there is any swelling or any pain. And let the patient know that they're in full control of the examination and they can stop you whenever they felt uncomfortable. So once you've done that for both breasts, you can ask the patient to use for the patient to use their 2 fingers and gently massage their nipples, and then you would be able to see if there is any discharge coming off. Again, if there was any discharge, try to describe the characteristics. So before we move on to the next stage of the examination, are there any questions at all? Okay, so moving on. Next, you would want to see or examine the lymph nodes. I tried to put a picture here, hope it's clear. You check the axillary lymph nodes and the supraclavicular the supraclavicular lymph nodes. You ask the patients, could you please keep your hand as relaxed and floppy as you can and allow me to do the movements. So again, with your non-dominant hand, you try to move their hand and use your 3 fingers again to check for the lateral lymph nodes, the medial, apical, anterior, and posterior. And as you're doing that, you need to let your examiner know which ones you're examining and let them know if you felt any swelling, or again, ask the patient if they felt any pain at all. Do this for both sides and then gently press on the supraclavicular fossa to see if there's any lymphadenopathy there. So this will bring you to the end of your examination. You thank the patient, ask them if they need any help dressing up, and suggest the further steps using SVAR. Just before you present your findings and differential diagnosis using SVAR, you can communicate with the patient and say you will report your findings to your senior and do some tests, and you'll update them once the results come back. So we're just going to go to some questions now and then come back to describing a lump. So what does the triple assessment consist of? Again, feel free to just unmute yourself or drop your answer into the chat box. Okay, so I can see some answers here. That's great. So history and examination, imaging, depending on the age of the patient, and tissue sampling. So we usually do fine needle aspiration if we felt like the lump is cystic in nature, and we do a core biopsy if it was if the consistency was harder. Next question. What mode of imaging is used for women aged over 35? Okay, great. I can see some answers here. So if the patient was younger than 35, we can use the ultrasound. And if they were over 35, we use the mammogram. So now, during your examination, if you felt a lump, you can use S3, C3, and T2 to describe the lump. So S3, that's site. For example, you can say that it was on the right breast in the right inner quadrant. The size, you can say it is approximately 3 centimeters in size. Shape, it is of a round shape. Consistency, so you can say it is soft and it has regular edges, and there are no overlying skin changes or overlying skin changes depending on what you see. So that's the color. T2, tenderness and temperature. If it's painful for the patient or sometimes with an infectious or inflammatory cause, the skin overlying the lump could be a bit warmer, and that's why you need to describe the temperature. So with breast lumps in specific, mobility and fixation is very important. If the lump was mobile, it could point you towards a more benign cause, while if it was fixated, it will point you towards a more malignant cause, and that's why it's very important to describe that. This again brings us to the end of our session. Do you guys have any questions at all? If you could, guys, fill the feedback form. The link was sent up in the chat. That would be great. So there's a question here. How do you examine the axillae? So do you mean the axillary lymph nodes or the tail of Spence? If you mean the tail of Spence, you take your thumb of your dominant hand and your 2 fingers and just keep pressing it like that, and see if you feel any swelling or tenderness or any nodularity. If you mean the axillary lymph nodes, then you just ask the patient to keep their hands as floppy and relaxed as possible, and you take with your non-dominant hand, you move their hand like this, because you would want to put your fingers under their arms, and you just press. If in the middle, that would be apical, and then lateral and medial. Lateral would be towards this arm, medial would be towards this arm, and then anterior would be towards the front, and posterior would be towards the back. Did that help at all? Okay, great. Any other questions? Okay, thank you very much, guys. Thank you for attending our next. Don't forget to watch our videos actually on our YouTube channel, and follow the BIDA page on Instagram to know when the next event is. Thank you very much.